here to talk to you about infant, child, and adolescent nutrition. Nutrition is one of the most important components of a growing child. So as you remember to consider the educational components of a well and annual child check, do remember that nutrition is one of those very important components. That comment, "you are what you eat," is very, very important to a child as it is to an adult. But in a growing child, it's important for the nurse practitioner to understand how the components that a child eats affects their growing, their life, and just their daily living and happiness in general. All right, so the first thing I wanted to talk to you about is just some basic foundation. So energy, okay? Three body processes require energy. Okay, and that's energy that we get measured in food or calories, okay, or also known as kilocalories. First one, I'm sure you guys are all familiar with, is just your basal metabolism. All right, primarily just those normal functions that we do without even thinking about it. How you breathe or respiration, digestion, temperature regulation, circulation, and so on. So most of the energy that our body uses is used for this function, okay, and that's measured in your basal metabolic rate. The next thing that our body uses energy for is growth. All right, and growth for the pediatric population is really the highest in infancy and in adolescence. That's where we see most of the growth for the child. And that's why when you're seeing an infant or an adolescent, nutrition is so important to discuss and encourage, because we want to make sure that they have the adequate and the best calories for their growth. And the last thing that our body uses energy for is activity, exercise, and other metabolic demands, even like illness. Okay, it's why it's so important for a child who is sick to get the adequate hydration and calories that they need, because our body only heals well when it is adequately nutritioned. All right, so the first thing I wanted to talk to you a little bit about, we're not going to go into major detail with pathophysiology. I expect by this point that you understand what metabolism is, Krebs cycle. I'm sure you guys would love to hear me talk about that for an hour, but I'm not going to. So the first thing I wanted to talk to you about is, let's see if I can find which ones I want here. Just basic nutritional recommendations. All right, so your Burns book has a really awesome table, and all of these tables that I go over in every one of these videos are pulled directly from your textbook so that you have direct source to that learning that I discuss in my presentations. Okay, we have age group here from 0 all the way up to 18 years old, as well as pregnancy. I would like to tell you that you're not going to see a pregnant adolescent, but you will. And in fact, our pregnancy rates are a lot higher in surrounding counties of New Hanover County and in Wilmington. If you're outside that area, then this statistic is not so much applied to you. But in our area of New Hanover around UNCW, we are seeing a very high climbing rate of sexually transmitted diseases and pregnancy, because we, as nurse practitioners and providers, are not allowed to discuss anything except abstinence in the school systems. So our kids right now, teenagers, you would think that they know a little bit about that, but since we are not allowed to discuss that, and we're only allowed to discuss abstinence only, they're not getting any kind of education on sexually transmitted diseases or contraceptive. So please remember that if you're caring for a patient in that surrounding area. All right. So between the ages of 0 to 6 months, you're going to see that a child doesn't obviously need quite as much, but the most important things in infancy are really going to be carbohydrates, okay, because carbohydrates are going to be the things that they need the most for a growing brain. Okay, when you look in comparison for how many grams per day that a 7 to 12 month old, you would think that it would be astronomically more between the ages of 1 to 3, but it's really not. Okay, it's only about 30 to 40% more, because in infancy, they need carbohydrates. If you have an infant that comes in to see you and they are failure to thrive, one of the first things you should be thinking about is, what kind of carbs is this infant getting in their diet? Okay, and the reason I am saying that, and when I say infancy, I really do mean 0 to 1 year, okay, because carbs are how babies gain weight. Okay, that breast milk and formula is very high in carbohydrates, and that's because that is the most important macronutrient, the highest macronutrient that a baby and child needs for the expenditure of energy. right? They also do need a fair share amount of fat, okay? But when you think in terms of fats, you're not going to be thinking that that is the most primary component if you have an infant that's not gaining weight. You're going to be thinking complex and simple sugars. Why are they not getting the carbs that they need? So when you're taking a look at just overall vitamins and minerals, this is a very good table. I am not going to go over this table, and I do not memorize this table, okay? This is not something that you're going to look at and say a 9 to 13-year-old boy needs 300 micrograms of folate each day. You won't memorize that. That's not, typical. What you'll do instead is have a really good way to keep this somewhere so that you can take a look at what the patient's age that you're seeing. And as you grow in your practice, you'll start to memorize the ones that you see most often. Okay, but remember to look to these nutrient components in your Burns book and print this table out. Take it with you because it's very helpful. This is in the nutrition chapter. All right, so next thing I wanted to talk about is caloric intake. All right, so for infants and toddlers, I hear, and you will probably hear, how many ounces, how many calories, etc. will this child need per day? Okay, and that's a difficult question to answer because it is so different depending on the child's age, depending on the child's weight. You need to be able to tell that parent specific to them what their needs are. Okay, so EER means estimated energy requirements. Okay, so when you take into consideration what a 0 to 3-month-old needs, okay, you're going to take into consideration 89 times their weight in kilos minus 100. Okay, and that lets you know what the calories that they need for the day are. You can also do it based on a 50th percentile for weight. The problem is that most of the kids you see are not going to be in that 50th percentile for weight. So telling a parent that the child needs 100 kilocalories per kilogram per day is a little bit more generalized, and you're better off just to use this estimated energy requirement calculation right here. Okay, this is again in your Burns book and is a really excellent way for you to, if your preceptor comes to you and says, go see this 7-month-old or 6-month-old well child check, if you really want to impress them and they say how many calories you think they need a day, figure this out. Take a screenshot, put it in your saved stuff, and remember that. These tables are an excellent way for you to get a glance of knowledge that you can actually use in real practice. All right, so as the kid gets older, okay, ages 2 to 18 years, you can use this table right here. All right, now what I like about this table is that it really takes into consideration, are the child or is the child sedentary, moderately active, or active? Okay, if you have a child who is getting zero activity during the day and spends a lot of time watching TV or playing video games, okay, I see that a lot in the 9 to 13 age group. You would definitely want to consider that child sedentary. And if they are overweight or obese, you would gonna go on the lower end of the scale. If they're not, you may say that they could have between this scale. But you really do want to give parents an estimated calorie count of what they should be eating at well visits. And the reason is, sometimes parents don't even know what their children should be having. And that's a problem because we have such a high rate of childhood obesity. All right. So the next thing I wanted to discuss is something you might see in both caregivers and also adolescents or kids. Veganism and vegetarianism are becoming a high activity, and that's really okay. People have their own personal beliefs and their own personal values and what they eat, and that's wonderful for them to have that. We see it a lot in parents who are vegan and vegetarian. They would also like for their caregiver or their kids to be vegan and vegetarian. The only thing that becomes a concern is when they do not get the adequate vitamins and minerals they need, okay, or even macronutrients such as protein. So you want to be careful in telling them that there are alternative sources for a vegan or vegetarian diet of ways that they can get vitamin D, vitamin B12, riboflavin, calcium, iron, and zinc. Okay, and so also for those macronutrients, protein becomes a little bit hard to get because they don't eat a lot of meat or any meat. So one thing I would recommend is that you tell them, obviously, beans, legumes, almonds, pecans, those are all things that are higher in protein for your vegan or vegetarian, okay? And then make sure that you talk to them about alternatives, because telling them that eating a vegan or vegetarian diet is not healthy or is not okay is less effective than telling them, I understand that you have an alternative lifestyle with your diet. Let's talk about the things that are good sources for you to use instead. All right, so next, I want to talk a little bit about mineral and vitamins. It's not common to see mineral and vitamin deficiencies in kids unless you see a child who has a metabolic disorder or has problems with major diarrhea or a GI disorder that causes excretion of certain vitamins and minerals at a high rate. But this table, that also found in your Burns text, is excellent about focusing on what the signs of deficiencies are, or also signs of excess or toxicities are. It gives really excellent dietary sources. Calcium's an easy one to remember, maybe magnesium, but iron might not be something you're super familiar with. So you will be able to understand that meat, eggs, vegetables, cereals, foods fortified with iron are excellent sources of iron for kids. Trace elements. Nobody remembers that. Okay, I have a hard time remembering what selenium, copper, manganese, and chromium are found in. So make sure that you're taking a look at these tables, so when you feel like you need to offer that kind of education about getting these trace elements or getting these other minerals in the diet, that you look to this table or look to sources to tell you. Okay, sometimes I forget that high copper is found in organ meats, seafood, nuts, seeds, etc. Now, you're not going to find many people eating organ meats, okay, but nuts, seeds, and seafood might be something that would be helpful or possible, as long as they're not a very young age, because we would worry about allergies to such as shrimp, lobster, etc. All right, so moving right on. There's also a good, see if I can find it. There we go. A good vitamin table. Okay, so vitamin D is something you know is probably found in most things that have calcium, but also the sunlight. Okay, tell kids to get out and play. Just, 15 to 20 minutes a day of direct sunlight with, of course, wearing appropriate sunscreen will help them get enough vitamin D they need to last them. Okay, vitamin K and vitamin E. We're going to find vitamin K in green leafy vegetables. Same thing with vitamin E. That is also found in green leafy vegetables. Okay, vitamin C is an easy one. You know that vitamin C is usually found in your citrus fruits, okay, like oranges, pineapples, strawberries, grapefruit, which most kids won't eat, lemons, limes, etc. Okay, some of your less common vitamins to remember, folate, liver. You're not going to see a lot of kids eating, again, those organ meats, but there's a lot of different vitamins found in green leafy vegetables. So one of the things I usually educate parents on is to utilize green leafy vegetables in things kids don't know they exist. So things like yummy smoothies, or things like spinach brownies, or things like pasta with tiny itty bitty bits of spinach sauce with a lot of cheese on it, etc. Sorry guys, that's my bird in the background. She likes to get her 2 cents in. All right, let's see here. The other one I wanted to talk about is infant formulas and milk. Now, I'm going to be very clear here in telling you that the best source of milk for an infant is breast milk. It's the best, hands down, recommended by the American Academy of Pediatrics by every single mom if it's possible. But do not be a breastfeeding crazy Nazi. If the mother chooses not to do it, or it's not possible for that mother to do it, that's okay. Just make sure that you have a really good alternative to focus on what kind of formula that baby needs, okay? And this table, also found in your Burns book, is incredibly helpful, okay? Now, the one that I wanted to focus on the most is if you have an infant who has got a cow's milk or protein allergy, severe multiple food allergies, malabsorption issues, any kind of allergic GI disorder, they're going to be on a free amino acid or totally hydrolyzed formula.